Ladies, how do you know if you need pelvic floor PT? There are a lot of common signs that get thrown around that people tend to be generally more familiar about nowadays, which is fantastic. However, there's a lot of signs and symptoms that people don't know about or aren't discussed as frequently. You may have been at a party where y'all are having a good time, a couple of beverages, and you're having a good laugh, and someone jumps up and says, "Oh, I gotta go to the bathroom before I pee my pants." And that's a pretty common sign and a pretty common story. However, I had one patient one time who had that happen and then was like, "Hey, what about pain with intimacy?" And all of her friends looked at her and like, oh no, we don't talk about that. So today we're going to talk about all of that stuff. And we're going to talk about how all of those things are connected through your pelvic floor. Because I've had many patients coming in recently with all of these air quotes around the word random symptoms that are actually all connected through your pelvic floor, but nobody's ever explained that to them. So that's what we're going to talk about today. We're going to cover the 8 most common signs of pelvic floor dysfunction. And I guarantee you that there will probably be 1 or 2 in here that do surprise you. So definitely make sure you listen to all 8 signs to see if this sounds like you. And if you find yourself in any of these signs or stories, I definitely recommend you finding a specialist physical therapist who can help you deal with your pelvic floor symptoms now. The reason why is because they don't tend to get better over time, they tend to get worse. So right now you may only have one symptom and it may not interfere that much with your day-to-day life, but what I found in my experience is that over time, more symptoms start to present themselves, it becomes a bigger problem, and it also takes longer to heal. So the sooner you start working at the specialist, the sooner you can get on your healing journey and not have these problems compound so that by the end of it, you're dealing with all 8. All right, we're going to start with the most common sign that luckily people do talk about nowadays, and that is peeing when you laugh, cough, or sneeze. Now, a lot of people do struggle with this problem and they consider it to be normal that when they laugh, cough, or sneeze, they do urinate a little bit. And for some people, it is actually a lot. I've actually worked with patients who were so concerned about this problem that they would have to wear a pad whenever they were leaving the house because they just never knew when it was going to happen. Now, this problem affects many, many women, and they tend to feel that it's normal because so many other people struggle with it too. Or maybe the doctor has even told you that it's normal to have this happen after you have children or as you age, that it's a sign of menopause and the changes in your pelvic floor. I will tell you that yes, your pelvic floor does change with menopause. It's definitely seen and scientifically researched. However, that does not mean that you should be peeing yourself when you're laughing, coughing, or sneezing, or that you should have to give up your favorite activities, including running, because you're suffering with pelvic floor dysfunction. So I struggle with this term because people say, oh, well, it's normal in that it affects so many people, which is true, but just because it has the ability to affect half of the population doesn't mean we should consider it normal. Now, I will say that nowadays, women's health and pelvic floor health has become more something that we're discussing, and doctors are starting to realize how important it is to get early treatment. So I'm super excited to see this change over time, and the younger population, the younger women who are having children now, to be reaching out for help early on. I think this is a very positive change. However, I also know that people who are a little bit more mature, like myself, did not get this advice when we were young and were just kind of brushed off now at this point. Now, I'll tell you, if you have these symptoms right now and you are in your 50s or 60s, you do want to get them taken care of still, because what can happen is you can lead to further problems, including needing a total hip replacement, which is actually due to a pelvic floor weakness. Now, you may think, total hip replacement, everybody gets those too. Friends, just because everybody's doing it doesn't mean it's normal. Remember what your mama said when you were growing up. If everybody else is going to jump off the bridge, are you going to jump off the bridge too? No. Let's fix the pelvic floor now and not have to have that total hip replacement. Now, symptom number 2 is actually on the opposite end of that spectrum, and that is not being able to fully empty your bladder or not being able to start going when you sit down on the toilet. Now, a lot of people don't understand that this too can be a pelvic floor dysfunction, but basically in this case, what's happening is that the pelvic floor is so tight that it cannot relax enough to let the urine pass completely. And this gets to be a big problem over time, which can even lead you to the emergency room because you have to get catheterized in order to be able to urinate. That's not what we want. We don't want to have to go to the emergency room for that. Doesn't matter how old you are. You don't want to have to go to the emergency room for that. So this is something that needs to be addressed quickly. Now, if you're suffering with this right in this moment, what I would recommend is trying to do some deep breathing when you sit down on the toilet. Doing some deep breathing activates the diaphragm, which decreases the tone in the pelvic floor. It may help you to be able to get everything out completely. However, if this continues for a prolonged period of time, more than once or twice, I would say, you definitely want to get help from a specialist and figure out why is it that your pelvic floor is so tight? Because your pelvic floor is just responding to the pressure that's being put on it. There's probably dysfunction somewhere else. Now, one of the symptoms that's less commonly known is pain in the SI joint area or the low back. So the SI joint is made up of the sacrum, which is the heart-shaped bone that's at the base of your spine, and the ilium, which are your hip bones, so one on each side. Sacroiliac joint, SI joint. Now, a lot of people who are suffering with SI joint pain actually do have pelvic floor dysfunction because the pelvic floor attaches right near the SI joint as well. It's all connected. And if you have any ilium mobility issues or any sacral torsion, this can put increased pressure on the pelvic floor because the muscles are not in the proper alignment. This can definitely throw off your pelvic floor and cause a whole bunch of other symptoms that people don't really realize are actually all related to a pelvic malalignment issue. Because again, friends, it's all connected. So if you're suffering with very deep low back pain or SI joint pain, definitely recommend making sure that you're working with a specialist who can not only treat SI joint pain and low back pain, but who can also work on the pelvic floor, because chances are that you're probably suffering with problems in both areas, and they both need to be addressed to relieve your pain symptoms. Now, I would say the most common symptom that brings people into my clinic is that they have pain to palpation or tenderness when they're inserting a tampon, or pain with intimacy. This tends to be the symptom that sends the red flags off, the sirens blaring, saying, uh-oh, I gotta deal with this. Now, I'm gonna tell you, if you are to this point, chances are that you have actually had a pelvic floor dysfunction for a period of time. And as you listen to these symptoms, you may be like, oh yeah, that's been going on for years. That's been going on for years. But you just started having that pain with either inserting a tampon or with intimacy. Well, I'm here to tell you that those red flags are going off for a reason, because that means that your pelvic floor dysfunction has progressed to the pain point, and it is definitely time to get help. It does not get better from here. Once you get to this point, it's like it's tipped over, you're on the other side of the mountain, and you're headed downhill fast. So you want to seek help from a specialist now to start addressing this problem. And they'll talk to you about the other symptoms that you may have been having for years even that progressed to the symptoms you're having right now. Now, many women are surprised to find out about the next symptom of pelvic floor dysfunction, which is hemorrhoids. So many women think that hemorrhoids are not necessarily related to the pelvic floor, but it definitely tells us that there's something going on with the pelvic floor. The challenge is that people get hemorrhoids and they try maybe over-the-counter treatments, or maybe they do something with their doctor. However, they don't actually treat the thing that's causing the problem in the first place, and that is a pelvic floor dysfunction. So you want to make sure, if you've started having hemorrhoids, or maybe you're just hearing this and been like, I've had hemorrhoids for years, but I'm starting to have some of these other symptoms, you want to seek help from a specialist. And if the symptoms before didn't get you to go see a pelvic floor specialist, I'll tell you that the thing that will bring people into my office is a prolapse. So what happens with this is that the pelvic floor actually starts bulging out because something is prolapsing into it. And it can be the vagina, it can be the uterus, it can be different organs. What happens is that women are washing themselves, they feel this bulge, they go go to the doctor and the doctor says, oh, you have a prolapse. And most commonly, the doctor will say you need to have surgery to tether that organ back up where it came from. Friends, you have a pelvic floor dysfunction, and now it's an organ mobility problem. So you need to find someone who can help you with both of these issues, because the organ is probably just stuck in the wrong position and can be helped out of that position, as well as your pelvic floor getting strengthened so that you don't have that bulging. However, you can't just start by strengthening the pelvic floor, because chances are that part of your pelvic floor is too tight. So if you try to do exercises just to strengthen your pelvic floor, then chances are good that you're actually going to make the prolapse worse, because it's going to increase the tension in the area of the prolapse. So it's important to make sure that you release tension before you do any strengthening, so that you get normal strengthening throughout the entire muscle. The least known sign of pelvic floor dysfunction, in my opinion, is constipation. Many women who come in to see me for one of the other reasons, when I start talking to them about constipation, they're like, oh, but that has nothing to do with this. Well, friends, chances are good that it's all connected, because most of them have tried changing their diet. Most of them have tried increasing their fiber. Most of them have tried over-the-counter medication. And although all of those things may help to decrease their symptoms of constipation, it doesn't actually solve the problem. Chances are that your pelvic floor is too tight and it has difficulty being able to relax enough in order to let everything out. And what happens then is it all gets backed up and it gets dry and it gets harder to push it out, which can then lead to hemorrhoids, which we already talked about. All of this stuff is connected, and it all points to your pelvic floor dysfunction. So definitely make sure, if you've suffered with constipation for a long period of time, that you talk to your pelvic floor specialist about that as well, to make sure that all of those symptoms are treated together. And the last sign of pelvic floor dysfunction may be the one that most people don't actually realize, but it's the inability to do a Kegel exercise. Now, Kegels are hard to do on a good day, and I don't recommend them. However, they are often recommended, so we talk about them a lot in the clinic. And people will tell me, I just feel like I can't do a Kegel exercise. Well, chances are good, if you feel like you literally cannot do a Kegel exercise, and in general you have pretty good body awareness, so you're just like, I don't understand why I can't do this one particular thing, chances are good that it's because your pelvic floor is actually tight. And if you have a muscle that is fully contracted and then you ask it to contract more, well, how is that supposed to happen? So you're trying to do this Kegel exercise and you're thinking about it and you're like, okay, let me feel it. Chances are good that what's happening is you're just tightly contracted, and what you actually need to do is learn how to relax that pelvic floor, because then you can contract and relax. So if you feel like I cannot do a Kegel exercise, I've tried, you may have even been to a pelvic floor specialist before and they did biofeedback with you and you were like, I just can't figure out how to do a Kegel exercise. Well, chances are good that it's actually because your pelvic floor is too tight. And what you need to do is have somebody help you to relax your pelvic floor so that you can actually do exercises. I'm still not going to recommend Kegel exercises. Let's do some exercises that are actually healthy for your pelvic floor, as opposed to Kegel exercises. All right, ladies, there it is, the 8 most common signs of pelvic floor dysfunction. Which one was the most surprising to you? Drop a comment below and let us know which one was the most surprising. And if you're struggling with peeing when you laugh, cough, or sneeze, I'm going to recommend that you download my free webinar. I'll include a link in the comments below so you can learn more about what's causing this problem in the first place and what you can do about it.